to order. Welcome, Senator Monning, and we'll be joined shortly by Senator Stone. Today we have two sections of the agenda, Part A and Part B. The first part, Part A, covers the Department of Social Services and the Department of Rehabilitation. We've got a vote-only calendar that we will go through for Part A of the agenda, as well as hear one item. After we complete Part A of the agenda, I'll talk a little bit about Part B and provide some direction and guidance to the public about how we're going to structure our public comment section of Part B. Thank you all for your participation and joining us today. And let's go ahead and get started with our perfect timing, Senator Stone. We're going to begin with our vote-only section of Part A of the agenda. We'll go issue by issue, and the rules of the committee is that we will have roll call. Let's start with issue number 1, ARC child support pass-through. I'll entertain a motion.
So moved.
Call the roll, please.
Senator Mitchell?
Aye.
Senator Monning?
Aye.
Senator Stone?
That's out 3-0. Issue 2, county sharing ratio alignment. So moved.
Senator Mitchell?
Aye.
Senator Monning?
Aye.
Senator Stone?
That's out 3-0. Issue 3, trailer bill language to eliminate the temporary assistance program. Call the roll, please.
Senator Mitchell?
Aye.
Senator Monning?
Aye.
Senator Stone?
That's out with a 2-0 vote. Issue 4, 2-1, I'm sorry. I was thinking 1 and said 0, forgive me. 2-1 vote. Issue 4, it's a BCP, IHSS, CMIPS, M&O.
So moved.
Senator Mitchell?
Aye.
Senator Monning?
Aye.
Senator Stone?
Issue 5 is a spring finance letter, transfer of commodity supplemental food program.
So moved.
Senator Mitchell?
Aye.
Senator Monning?
Aye.
Senator Stone?
That's out 3-0. Issue 6 is the spring finance letter dealing with Title 4E.
So moved.
Senator Mitchell?
Aye.
Senator Monning?
Aye.
Senator Stone?
That's out 3-0. Issue 7, spring finance letter on county expense claims.
So moved.
Senator Mitchell?
Aye.
Senator Monning?
Aye.
Senator Stone?
That's out 3-0. We'll move on to item 5180, the Department of Social Services, issue number 8. It's a budget change proposal on random inspections.
So moved.
Senator Mitchell?
Aye.
Senator Monning?
Aye.
Senator Stone?
That's out 3-0. Issue 9, another BCP on caregiver background checks.
So moved.
Senator Mitchell?
Aye.
Senator Monning?
Aye.
Senator Stone?
Issue 10, budget change proposal on home health care services.
So moved.
Senator Mitchell?
Aye.
Senator Monning?
Aye.
Senator Stone?
That's out with a 2-1 vote. Issue 11, BCP on the complaints and appeals process.
So moved.
Senator Mitchell?
Aye.
Senator Monning?
Aye.
Senator Stone?
That's out 3-0. Item 5160, Department of Rehabilitation, Issue 1, BCP on the competitive integrated employment.
So moved.
Senator Mitchell?
Aye.
Senator Monning?
Aye.
Senator Stone?
Issue 2, a BCP on RSA 911 reporting.
So moved.
Senator Mitchell?
Aye.
Senator Monning?
Aye.
Senator Stone?
That's out 3-0. Issue number 3, BCP on supplemental funding for traumatic brain injury.
So moved.
Senator Mitchell?
Aye.
Senator Monning?
Aye.
Senator Stone?
That's out on a 3-0 vote. Thank you very much. That completes the vote-only calendar for Part A of our agenda. We'll move to items for discussion. Issue number 1, which is a proposal for investment. We're on page 9 of the agenda. And we'll have LAO and Finance join us. And we're going to hear about the proposal from the California Farm to Food Bank Tax Credit. Welcome and thank you for being here. Go ahead and get started.
Thank you, Madam Chair. Andrew Shane from the California Association of Food Banks. Last year, we brought forward a proposal to extend and improve the existing tax credit for farm donations to food banks. It received unanimous support in the legislature to see a veto from Governor Brown, and the veto message said that he would prefer to see tax credits done in the budget process. So here we are. Thank you for your time. Madam Chair, I've testified to you before about hunger in our state. I just don't think we need to cover that territory. But I'm very excited to speak about this innovative way for our state to leverage a minimal investment to trigger tremendous private sector support to address a very serious human services issue of hunger. And I think it's really a model for how we can have private sector involvement in our pressing human services issues. So just to be brief, the existing credit is effective, but it's limited. It's only for fresh produce. So as important as that is, we're seeking to bring in donations around complete nutrition. So the proposal would expand the eligible products to meat, dairy, eggs, rice, beans, and other products that we can really provide a full amount of nutrition for folks in need. We're also seeking to address what right now is a very complicated methodology. It uses what's called inventoried value, a method of valuation that most farmers don't normally calculate. Most farmers are family farmers. They file their taxes as individuals, just as we do, and they don't normally calculate this inventoried value. So moving to wholesale simplifies it, makes it easier, especially for smaller family farmers to take it. At the same time, we'd like to move the valuation to 15% because of the items we're seeking to include, things like eggs especially, or nuts. Very competitive markets. We don't actually anticipate getting very many of those donations, but 15% gives us a better chance to compete in that space. And finally, of course, to extend the sunset, we will expire at the end of this year. It is a proven program. Just some data on that. For example, even under the existing limited program, we've increased donations by 1/3, and we've increased donors by 1/2. So really, this is truly incentivizing behavior. It's not rewarding behavior that would have otherwise occurred. I know that's an important piece when we look at tax credits as a policy measure. And I would just close by noting that this provides an incredible return on state commitments. So every dollar brings in 10 to 20 pounds of food. Of course, things like tomatoes weigh a lot more per pound, right, than lettuce, right? But that's the kind of metric we can give you there. And again, this proposal has an estimated cost of $1.6 million a year. So we're at about $500,000 under the current law. This would bring us to about 1.6, but that would bring in more than $10 million in food, right? We know from Feeding America that the missing meal gap is about 1 billion meals in the state. And it would take food banks around $300 and some million to close that gap. So this 10, is a really important way for the state to only put forward a chunk of that, 1.6, but to really start to make a dent in hunger, at the same time reducing food waste, getting these edible products out of landfill, and getting them to the people who need it most.
Good afternoon, Noelle Kramers with the California Farm Bureau Federation. We think this is a very valuable program, but there are some tweaks that could make it even more valuable and really improve the incentives. California farmers do a great job of producing healthful foods for Californians and for the world. We produce over 400 different commodities in California. And these are very high quality products that would be made available to the food banks. Switching to wholesale value would make it much, much simpler for our members and would really incentivize it for them getting the food to the community members that really need it and are suffering.
Excellent, thank you. LAO?
Thank you, Madam Chair. Ryan Woolsey with the LAO. We don't have any specific comments or recommendations at this time, but we're available to answer any questions or provide technical assistance.
Appreciate that. Finance?
Madam Chair, Jay Chamberlain with Department of Finance. We just note with concern the revenue loss associated with this proposal.
Thank you. Any questions, colleagues? Senator Stone.
Thank you, Madam Chairwoman. Not necessarily a question, just I'm delighted to see this proposal coming through. Riverside County is a large agricultural county, and I've heard from a lot of the farmers out there that they need these types of incentives to create the win-win, where you're investing 1.6 and getting $10 million worth of food for our needy people in the state of California. So I know we're not voting on it today, but I'm going to support it when we do.
Excellent. The math seems pretty simple. And in the governor's veto message of last year, any indication beyond just that he thought it was more appropriate in the budget?
It was a package-wide veto, so I really couldn't
Got it.
speculate. It didn't appear to be a specific target.
Fair enough, fair enough. Okay, thank you. We have a wonderful list of several dozen organizations in support of the concept. I see we have public comment. We ask that you keep your comments brief, and please step up. Tell us who you are. Thank you.
Kimberly Chen on behalf of the California Pan-Ethnic Health Network in support of this proposal to extend access to healthy foods for low-income Californians, particularly important considering the number of children who are in poverty and low income. You know, when children go to school without being nourished and fed, they do poorly, and we see that chain reaction down the line, and very much in support of this proposal.
Thank you very much. Next witness, please.
Michael Dimick from Roots of Change, also in support of the bill. We think this is a great way to remind all Californians, particularly those of low income and in need of food, that California farmers are here to support them.
Thank you. Next witness.
Alyssa Helpy with California Citrus Mutual. We are in support of the proposal. Last year, Citrus donated 19 million pounds of fresh citrus to food banks throughout the state of California, and that number could be easily more with the proposal made today, so we humbly ask for your support.
Thank you. Next witness.
Hi, Carly Finkel from the Food Bank of Contra Costa and Solano. Our food bank has been able to increase the amount of produce that we distribute in recent years, in part thanks to the existing tax credit. Over half of the food that we distribute is fresh fruits and vegetables, and so we hope that the expansion and increase would be able to bring in more produce for us to distribute, as well as other high-value goods like eggs and meat and dairy products. So in full support of this. Thank you.
Thank you. Next witness.
Hi, Melissa Romero with the environmental group Californians Against Waste. Expanding the categories that donate food eligible for state tax credits and simplifying the process for donors is going to significantly increase the amount of nutritious food going to families in need, which addresses both hunger and food waste in California. Thank you.
Thank you. Next witness.
Morning, Madam Chair. Justin Milan for the Community Alliance with Family Farmers and the local environmental health directors. For the reasons stated before, we very much support this proposal, especially the switch to the wholesale value. Thank you very much.
Thank you.
Michelle Stoll-Parvensky, Children's Defense Fund, California, in support of this proposal as a strategy to address child hunger. Thank you.
Chair and members, Kathy Mossberg with the California Food Policy Advocates, also in support for all the reasons mentioned.
Thank you very much. Appreciate you bringing the proposal forward, and we'll hold the item open. Thank you. We'll transition now to Part B of the agenda, where we'll hear from two departments, Department of Managed Healthcare first, or one department actually, Department of Managed Healthcare, on two items. We'll start with the Coordinated Care Initiative and then hear about the Health Insurance Premium Rate Review Grant Reappropriation. We'll take public comment following each of those issues. And then we'll move on to proposed investments, all health focus. That'll start on page 5 of the agenda. So let's begin with issue 1, Coordinated Care Initiative. Good morning.
Good morning, Madam Chair and committee members. My name is Marta Green, and I serve as the Chief Deputy Director at the Department of Managed Healthcare. With me, I have Jennifer Clark, our Chief Financial Officer. Tried to promote her. So the first issue before you today is the Coordinated Care Initiative and Ombudsman Spring Finance Letter. The Coordinated Care Initiative, or CCI, is a 3-year demonstration project in 8 counties to provide better health outcomes and program satisfaction for Medi-Cal beneficiaries. The DMHC, although a small player, does play an important role through an interagency agreement with the Department of Healthcare Services for the CCI program. We conduct triennial medical plan surveys, and we provide oversight to the CCI Ombudsman program. Funding and limited-term position authority provided in previous years for CCI will expire on June 30th of this year. So with that, the DMHC requests that the limited-term resources amounting to $1.46 million for fiscal year 16-17 and $522,000 for fiscal year 17-18 to continue our CCI efforts of transitioning the dual-eligible enrollees and participating counties into the managed healthcare programs, as well as providing consumer assistance through the CalMedi Connect Ombuds program. These figures include reimbursement authority from DHCS in the amount of $1.07 million for fiscal year 16-17 and $432,000 for fiscal year 17-18.
Thank you. LAO, Finance, colleagues, public comment.
Good morning, Madam Chair and members. Tam Ma with Health Access California here in strong support of this proposal. We want consumers who are being transitioned into CCI to have access to the health center, as well as DMHC's work to ensure that the networks serving these individuals are adequate.
Thank you. Next witness.
Linda Way with Western Center on Law and Poverty. Consumer assistance is a critical part of this program, and we are in support of this proposal.
I'll entertain a motion to approve the proposal.
So moved.
Please call the roll.
Senators Mitchell,
Aye.
Monning,
Aye.
Stone,
That's out 3-0. Thank you. We'll move on to issue number 2, the health insurance premium rate review grant reappropriation.
Back in 2011, the DMHC was awarded a 3-year federal grant in the amount of $2.1 million. The purpose of this funding was to improve our premium rate review data collection, analysis, reporting, and consumer access to the data. The Centers for Medicare and Medicaid Services, CMS, recently approved an extension of that fund through September 30th of this year. With that extension, we can use $100,000 of these funds to contract with a consumer advocacy organization to provide specific input and comments on the rate filings that will become effective on January 1st of 2017. We anticipate that these rates will be filed with the department in late June or early July, so the majority of these costs will be incurred in July and August of this year. So the DMHC is requesting to reappropriate unspent federal funds from that Cycle 2 rate review grant from fiscal year 13-14 to fiscal year 16-17 in order to enter into that contract.
Thank you, LAO. Finance, colleagues, public comment.
Tam Ma with Health Access and Support.
Thank you.
So moved.
I'll entertain the motion to approve the proposed budget bill language. Call the roll.
Senators Mitchell,
Aye.
Monning,
Aye.
Stone,
Thank you very much. Have a good afternoon. That's out 3-0. We will now transition to our health-related proposals for general fund or special fund investment. The process that we'll use for this section of the agenda is to have the LAO make the presentation on all the proposals. We have received all of the letters requesting the proposals, letters of support. Thank you, Luann, they're all tabbed. So I want you all to know that we've received your letters, we've read them, we've tabbed them. I have them here that we can reference if there are any specific questions that come up with regard to the proposal, because we're clear that LAO will do a high-level presentation on all 30. And what we're going to do is run through, we'll also have an opening statement from the Department of Finance. What we're going to do is run through all of the proposals for investment and then open it up for comment. I won't give you a time limit. I'll ask you all to self-police. But just, as you go through your public comment about the proposals that you're speaking to, just, tell us the proposal and then go through and make your comments. We thought that was the most efficient way to kind of manage this entire process in hearing the proposals for investment. Everybody comfortable with that process? Excellent. Let's hear from the Department of Finance. Thank you for coming.
Thank you, Madam Chair. Jamie Metalka, Department of Finance. While the administration has provided technical assistance on a certain number of these issues about to be heard, we, at this time, do not support the position or the proposals.
Thank you very much. With that, let's go ahead and get started with the first proposal. Again, we're starting on page 5 of your Part B agenda, hearing from the Ledge Analyst's Office.
Thank you. Amber DG, Legislative Analyst's Office. I, along with my colleague Ben Johnson, will be presenting these stakeholder proposals, and the LAO does not have a position on any of these proposals. We'll start with the Health and Human Services Agency. The California HIV Alliance, Project Inform, and CalHEP request funding to establish an interagency task force to address HIV, hepatitis C, sexually transmitted infections, and drug user health at a cost of $500,000 general fund. Senators Allen, Liu, and McGuire and other stakeholders request funding to support the Cal Quality Care website, which provides information on state citations, quality comparisons, staff salaries, finances, and costs for an array of long-term services and supports at a cost of $500,000 special fund. Moving on to proposals for the Department of Healthcare Services. Various stakeholders request to expand Medi-Cal to cover adults who are otherwise eligible for Medi-Cal except for their immigration status. The cost at this time is unknown. Multiple stakeholders, including Western Center on Law and Poverty, Health Access, CPEN, and Consumers Union, request to limit a state recovery in the Medi-Cal program by requiring collection for only those healthcare services required to be collected under federal laws at a cost of $26 million general fund. Western Center on Law and Poverty requests to increase the amount of income that is disregarded in calculating eligibility for purposes of the Medi-Cal Aged and Disabled program at a cost of $30 million general fund. Advocates seek a 1-year delay in implementation of the newly qualified immigrant RAP in Medi-Cal. Currently qualified immigrants within the 5-year bar, ages 21 to 64 without children and with incomes below 138% of the federal poverty level are enrolled in full-scope Medi-Cal. Starting in 2017, these newly qualified immigrants would be given the option to duly enroll in covered California and Medi-Cal. The cost to this delay would be $31.8 million general fund. The 2009 budget eliminated several Medicaid optional benefits from the Medi-Cal program. I'll go through these benefits and the current estimated costs from the administration. However, it is our understanding that these estimates will be revised at May Revise and that the cost will potentially be significantly higher than what's currently been estimated. Acupuncture services are estimated at a cost of $2.1 million general fund to restore. Audiology, a cost of $2.4 million general fund. Chiropractic services at a cost of $3 million general fund. Incontinence cream and washes at a cost of $5.6 million general fund. Optician and optical lab services, there's a revised cost estimate for this compared to the agenda, a cost of $20 million general fund. Podiatry at a cost of $13.5 million general fund. Speech therapy at a cost of $160,000 general fund. And a full restoration of adult dental at a cost of $98 million general fund. The California Clinical Laboratory Association requests the elimination of the retroactive recoupment of rate reductions pursuant to AB 1494 at a cost ranging between $31 and $81 million in one-time funding. Various stakeholders, including the California Dialysis Council and dialysis providers, the California Birth Center Association, the California Medical Transportation Association, the California Medical Association, and the California Clinical Laboratory Association, request the elimination of the AB 97 payment reductions at a cost of approximately $200 million general fund.
And starting with number 10 on page 7, various stakeholders request the elimination of the recoupment of retroactive Medi-Cal payment reductions pursuant to AB 97. This would be a one-time cost of $135 million. Number 11, the California HIV Alliance proposes a rate increase for the AIDS Medi-Cal waiver program at a cost of $4.8 million. Number 12, the California Collaborative for Long-Term Supports and Services requests an unknown amount to provide one-time grants or low-interest loans to incentivize expansion of CBAS and PACE programs. Number 13, Planned Parenthood requests to revise the Medi-Cal and Family Pact reimbursement formula for drugs and supplies dispensed by specific clinics by requiring the clinic dispensing fee to be the difference between the actual acquisition cost of a drug or supply and the Medi-Cal reimbursement rate, and removing the maximum dispensing fee caps in existing law. This would be $6 million. The California, number 14, the California Latino Legislative Caucus and other stakeholder groups request $200,000 to align Medi-Cal's health plan data collection and reporting requirements for race, ethnicity, language, and sexual orientation and gender identity data with Covered California's proposed 2017 qualified health plan standards. This would be $200,000. Number 15, various stakeholders, including California Latino Legislative Caucus and AFSCME, request $15 million for interpreters in the Medi-Cal program. Number 16, physical therapists request to lift a restriction on physical therapists performing electroneuromyography in Medi-Cal. The cost would be unknown. Number 17, Senator McGuire requests Medi-Cal rate increases for licensed home health agencies for private duty nursing services provided to children in 3 regional pilot areas that are currently facing access to care challenges. SB 1401 by McGuire would implement this proposal at a cost of $7 million. Number 18, Assemblymember Ridley Thomas requests to fund 2 limited term positions at 24 months to provide technical assistance to assist in the development development and expansion of school-based health centers. This would be $600,000 from the special fund, the Tobacco Settlement Fund.
Moving on to proposals under the Department of Public Health at the top of page 8. Advocates propose to restore funding for the Children's Dental Disease Prevention Program at a cost of $3.2 million general fund. Various stakeholders, including the Children's Partnership and First Five Association of California, request funds to establish a virtual dental home grant program to expand services to about 20 additional counties at a one-time cost of $4 million general fund. Various stakeholders, including the California Legislative Black Caucus, the March of Dimes, and the California WIC Association, request funding for the Adolescent Family Life Program, cost of $6 million general fund. The AIDS Healthcare Foundation requests an augmentation for the Sexually Transmitted Disease Control Branch at the Department of Public Health for sexually transmitted disease prevention at a cost of $10 million general fund. The Drug Policy Alliance requests to establish a grant program for local agencies and community-based organizations in order to reduce the rate of fatal drug overdose caused by prescription analgesics and other drugs at a cost of $3 million general fund. Stakeholders such as CalHEP and Project Inform request $100,000 for Department of Public Health to purchase and distribute hepatitis B vaccines to local health jurisdictions. $600,000 for Department of Public Health to purchase hepatitis C rapid test kits to distribute to community-based testing programs. $500,000 for DPH to certify non-medical personnel to perform rapid hepatitis C and HIV testing in community-based settings. And finally, $200,000 to the Department of Public Health Office of AIDS for technical assistance to local governments to increase the number of syringe exchange and disposal programs throughout California and the number of jurisdictions in which syringe exchange and disposal programs are authorized.
And to Proposal 25 on page 9, various advocates, including the Natural Resource Defense Council and the Breast Cancer Fund, request an augmentation for the biomonitoring program to increase the support for scientific work of this program. The funding would be split between DPH and the Department of Toxic Control and the Office of Environmental Health Hazard Assessment, all at a cost at $1 million. Number 26, various stakeholders, including the Alzheimer's Association, request funds for the California Alzheimer's Disease Centers for early detection and diagnosis of Alzheimer's disease. The funds would be used to determine the standard of care in early and accurate diagnosis, provide professional outreach and education, and evaluate the educational effectiveness of these efforts. It would be $2.5 million in one-time funding. Number 27, the Health Officers Association of California requests $1.2 million to reinstate the Lab Aspire program or a similar program. The funding would support 6 assistant lab directors as they train and gain experience to become public health lab directors. Number 28, the Health Officers Association of California requests funding to implement recent innovations in TB prevention at a cost of $10 million. Number 29, the Health Officers Association of California requests to create a public fund using general fund that would assist with chronic illnesses such as heart disease, stroke, diabetes, and cancer to help individuals survive with those at a cost of $390 million. Number 30, advocates and individuals with Parkinson's propose to fund the California Parkinson's Disease Registry to support competitive grants and contracts to research institutes, universities, and nonprofit organizations to implement and maintain a comprehensive Parkinson's disease registry at a cost of $3.7 million. Number 31, the Assembly Select Committee on the Status of Boys and Men of Color in California requests funds to provide support to qualified nonprofit organizations to support 1, health equity, 2, educational access, 3, youth development, 4, improved employment and labor force participation, and 5, decreased contact with children, with child welfare, law enforcement, and the juvenile and criminal justice systems. $100 million general fund at one time. And number 32, Senator Monning requests $150,000 to establish a telephone line for answering end-of-life Option Act inquiries and require that the individuals answering be bilingual. SB 1002 Monning would implement this request. This would come at a cost of $150,000.
Continuing on with number 33 at the top of page 10, the California HIV Alliance requests to eliminate cost sharing for individuals enrolled in the AIDS Drug Assistance Program with incomes between 400% and 500% of the federal poverty level. The Department of Public Health estimates that 112 ADAP clients paid an ADAP share of cost. By eliminating the ADAP share of cost obligation for these 112 clients, ADAP would have saved about $67,000 in calendar year 2015. The California HIV Alliance proposes the development of a pre-exposure prophylaxis affordability program to cover pre-exposure prophylaxis-related copays, coinsurance, and deductibles incurred by all individuals accessing pre-exposure prophylaxis in California with annual incomes below 500% of the federal poverty level. The cost would be $1 million in special fund. The California HIV Alliance requests that the Office of AIDS Health Insurance Premium Payment Program cover premiums, copays, coinsurance, and deductibles incurred by all eligible people living with HIV/AIDS in California at a cost of $8.6 million special fund. Moving on to proposals for the Office of Statewide Health Planning and Development. Various stakeholders, including the California Medical Association, the California Academy of Family Physicians, and the California Primary Care Clinic Association, request funding of $82.5 million for Song Brown program to increase residency programs for primary care physicians, and funding of $17.5 million to establish new teaching health center sites offering additional primary care residencies and other efforts related to graduate medical education. Finally, the County Medical Services Program, or CMSP, requests to expand the state loan repayment program and the Allied Health Loan Repayment Program in CMSP counties using CMSP funds. The CMSP Governing Board would provide funding for this purpose over a 3-year period with an estimated cost of $4.85 million, including $350,000 for OSHPD to administer.
Thank you very much for that. Colleagues, questions on the proposals? Senator Stone?